right, good morning, Mr. Smith. My name is Ansley. I'm gonna be your nurse for today. We're gonna go ahead and assess your chest tube, the lining, and change your dressing and change the tubing as well. Are you in any pain this morning?
No, sir. Oh, ma'am.
All right, can you verify your name and date of birth for me?
Willie Smith, 4799.
All right, and we don't have any allergies, do we?
No.
Okay, perfect. So what I'm gonna do is I'm gonna start off by just assessing your lung sounds real quick. So I'm gonna go ahead and pull down your gown and give those lungs a listen. All right, those lungs sound all clear to me. Your O2 levels are at an adequate level and you don't show any signs of respiratory distress. So we're gonna go ahead and continue. We're not in any pain this morning, are we?
No.
All right, so I'm gonna lift your gown and your covers up and we're gonna assess the site. Your dressing looks not intact and it's kind of fallen off, so I don't have a transparent dressing. We're gonna feel around, make sure that we're not showing any signs of swelling or emphysema, and then we're gonna go ahead and take this dressing off. Again, checking the site, making sure that there's no drainage, or if there is drainage, we're taking note of the color, smell, consistency, things like that. Just making sure that we're not showing any signs of infection. So we're gonna go ahead and put this new dressing on, and we'll leave it there like that. All right, next thing we're gonna check and make sure we don't have any loops or any kinks in the tubing. But we're actually gonna go ahead and change out this tubing. So we'll go ahead and get that clamped. We're gonna use 2 clamps, making sure that I'm 1.5 centimeters or inches away from the dressing, and then 2.5 inches away from the dressing, making sure that my clamps are facing opposite directions. Then we're gonna take our tubing here, we're gonna take this tape off. We wanna make sure that we don't, we keep everything sterile and don't touch this end part to anything. We'll get our new tubing, we'll insert it here and make sure that we don't touch that, and we'll secure it with a new piece of tape. Making sure that we have a nice seal. We're gonna go ahead and unclamp our tubing here. Making sure that we don't have any kinks or any loops in the tubing, making sure that there's a consistent flow. We're also gonna make sure that we, that our sterile water is at the appropriate level. Our doctor has prescribed that it should be at 2 centimeters. So we're gonna go ahead and fill that up. All right. Well, we'll dispose of everything properly in the proper bins and whatnot. And then we're gonna cover our patient back up. All right, are we still not experiencing any pain, Mr. Smith?
No, no pain.
Okay, perfect. All right, so I'll go ahead and leave you be. I'm gonna lower this bed back down, make sure your wheels are locked, your call light is right here beside you, and I'll come check on you in a little bit.